To give back to the society and to improve the health of Edo people, the management of University of Benin Teaching Hospital, UBTH, don't begin their free cancer screening for breast, cervical, and prostate cancer. This free screening will be from 12th to 31st January 2023. They're part of the activities to celebrate the 50th anniversary of the hospital. Chief Medical Director for UBTH, Professor Darlington Obaseki, for him talk with Tori people, say cancer na very deadly disease when they keep people well, and na this one can make the hospital chook body inside to make sure say people fit tackle am early.
Cancer generally is an epidemic that is we don't realize in this part of the world. In our data from UBTH, cancer is the #1 cause of death. The incidence of cancer worldwide is very high. In Nigeria, it's even higher now, and it's growing. So we chose it as one of our themes for giving back to the society, to create awareness about it, to screen so that we can detect the early cases and to offer treatment options to our citizens. That's why we are doing this. There's a whole gamut of activities for cancer that we do in UBTH. There's a lot of things we do, from prevention, from health awareness, to diagnosis, to treatment, to palliative care. All these old things we do here in UBTH. We like I said earlier, we realize that UBTH, we see a lot of cancer cases and a lot of referrals from all other hospitals. We are practically the only center that really manage these cases in this region. So we have all the facilities to do all this for screening for this center now. We have a Center for Disease Control, which is one of its kind in this country, where we screen apparently well persons for these cancers. We have diagnostic capabilities. You can see, I just did my PSA test for prostate cancer. We can diagnose for breast cancer, for cervical cancer. So we have the diagnostic capability. We also have a lot of treatment capabilities. For example, we are one of the few centers in the country that give what they call microdosing for chemotherapy, where we are able to share drugs among different patients. Not these drugs. Sometimes if you open it, you can't use it for another patient. But yeah, we are able to, so that way, bring down the cost. But despite all this, we also have a radiotherapy, brachytherapy center. We still have a lot that we still need to do, which we are not yet doing, which still needs support. And we are talking with the Minister of Health. The Minister of Health is very keen on this. There's a radiotherapy machine that is coming soon, which make UBTH the only center in the South offering this radiotherapy machine. So because of all this, that's why we are the referral center for cancer cases in this region. What you not know fit kill you. Not just that as a medical doctor, that is ignorance. So it's better you know. That's why we are doing this. It's better you know and stop and prevent it from killing you. I think there's a parable in Benin that says that if a stone you see coming should not blind you. So that's what this was all about. Let's see these stones. There are a lot of stones coming at us. So what preventive, what evasive measures can we take? What do you not know if it kill you? So we want to make you know, so I make it not kill you.
Representative of Edo State Commissioner for Health, Dr. Jeffo Stevenson, talks say this free medical outreach na correct initiative and make the general public take advantage to do check for their body.
If you recall, on the 2nd, 3rd, 4th, the Edo State Minister of Health, we are at Ekpoma in Eastern West local government area for such a program. We discovered that cancer, cervical cancer to be precise, if diagnosed early, can be treated and managed effectively. And the state are not relaxing their zeal in making sure that area is addressed. So UBTH coming up with such innovation at this point in their Golden Jubilee celebration is a welcome development, as is falling in line with the vision of His Excellency, the Governor of Edo State, Governor Obaseki. So we are so happy to have this at this time in our domain, and I want to appeal to the general public that they should tap on this opportunity and use to address such ailment within our society. I want to tell the general public that cancer is not a death sentence. It's what can be managed and is treatable when diagnosed early.
MD of Worldwide Healthcare, Navin Pala, will be one of the partners of UBTH, constitute mouth atop the matter.
As you all know, Worldwide Healthcare is one of the leading and the pioneer distributor for healthcare products in Nigeria. And we partner with almost all the healthcare professionals. And UBTH is special because it's a premier institution and center of excellence. And the unique thing about UBTH is they're quite progressive in terms of their initiatives when it comes to cancer care and other things. So that's the reason we have decided to partner more aggressively and more proactively with UBTH.
Some of the resource persons can't chook mouth with Tori people for this deadly cancer disease and how to avoid them.
Cancer is a big burden in Nigeria today, and especially for the men, prostate cancer is the most common cancer among men, and it's a black man disease. It affects black men more than any other race in the world. And if you know, the West African sub-region have the highest concentration of black people in the world, and because in Africa, in Nigeria in particular, we don't go for regular medical screening, people tend to miss their prostate cancer early, and by the time they come down into it, it's something that we cannot cure, and we just only have to manage, and most times it has their consequences. So we are advising people to take opportunity of this kind of program that the University of Benin Teaching Hospital has provided for free cancer screening, to screen for their prostate to know whether there's cancer there or not. And I advise every man that is over the age of 50 to go for prostate cancer screening every year. They should make it as part of their routine. Like in some clients, once you are over 50, it's like your birthday gift from the government. Every year on your birthday day, they make you do a prostate-specific antigen, which is popularly known as PSA. But in Nigeria, I think our government is yet to get to that stage. And I use this medium to employ the federal government and state government to look into it, to make sure they do a regular cancer screening for their populace. It will go a long way to improve our health indices.
We're having the free cancer screening for breast, cervix, and prostate. And these cancers that I've just mentioned now, they are the major cancers in male and female. What they have in common is that your chances of having cancer, it increases as you get older. And of course, for the prostate, for the fact that you're a man, means that you can have prostate cancer. The fact that you're a black man means you can have prostate cancer. Then the fact that you're even a black man in a developing nation where you have poor socioeconomic status means you have high chances of having a prostate cancer. For the breast and the cervix, breast affect women mainly, cervix affect only women. It's also a devastating cancer. But the luck we have is all these cancers, they are preventable, and once detected early, they can be treated. So we thank the management of UBTH for this initiative, because what it does for us now is open doors for the public to have an idea of what we do, because we are the first center that started the Well Persons Clinic, where you are apparently well, you just come in and you get screened for non-communicable and communicable diseases. These cancers are part of the non-communicable diseases. So what are the factors that lead to this? And that's why you're talking about the lifestyle thing. Some you have control over, some you don't have control over them. Things like your sex, the family you are born into, your age, you don't have control over it, you understand? But with respect to what you take in and what you do. Take, for example, your diet. We should try and eat food that is rich in micronutrients, eat a lot of vegetables, eat a lot of fruits, take a lot of water. We need to rest well, sleep well, so that we take care of stress. We need to consume, if you must consume it, if you must consume alcohol, it should be moderate. If you can, don't take tobacco, don't smoke, because these are very high risk things. Then again, people need to be empowered so that we come out of poverty, because if you even detect the cancer early, finance might be a problem, you understand? So we need to empower people so that they come out of poverty. Then of course we need to educate people about this cancer and other preventable diseases. But most importantly, you need to get screened at an early age, because like I told you, as you age, your chances of having this cancer also increases. So once we educate people, people come in for screening regularly. For the prostate, you do your prostate-specific antigen test. For the cervix, you do your pap smear. And for the breast, you do your clinical-based examination. In fact, for the breast, you actually can also do your self-breast examination. So if we teach women on how to examine themselves, then they should be able to detect whether they have lump or not, and then they come to a hospital, and then we can take it up from there.
Some of the beneficiaries of this free healthcare screening talked in a better initiative from UBTH, and this one go help people know their health status.
Well, I've actually not been screened. I'm going to do that now, but I've been asked to come here. And what I feel is a laudable thing to do, and it will help Benin residents. It will go a long way in letting them know the status in terms of health. And as we heard earlier, breast cancer is the highest in the country and globally as well. And we need to curb it. So it's a good thing they are doing it and making it go public. The awareness is great, and we commend UBTH for this laudable program they are doing.
I think the hospital management has done very well. It's a very essential service which many people need to undertake, because it is one of the biggest problems women have. And I've lost some friends even recently due to this cancer. So I will encourage men particularly to come forward and carry out this test, because life is short, and it is even worse when you have it and your children, your family members are traumatized, not just you who is sick. So I encourage all those who are not come forward to come forward. It's not expensive, as we are told now. It's not as expensive as we think. So the earlier we all learn to carry out this test, the better for all of us.
I did this cervical test the year 2020, and it was a good one. It was a good result. So I urge men and women to always check on their body, to know how their body is. When I came then, I was afraid. I don't know what they would give me as result. But when I entered, I was waiting for the result. They said everything is perfect. Then when I entered, the nurse that attended to me checked my breast. She was doing her head somehow. My mind fly. I said, I should have a good result. When I came out, when the result came, they said perfect. So some people came and the result was not okay. So on my own part, I was happy. Here I am again to do the test again, cervical and breast cancer test.
The free cancer screening exercise being done by University of Benin Teaching Hospital to mark their 50th anniversary is a seamless process, and it's highly commendable because this is something that we need in our communities, to give people the opportunity to know their health status. If you know your health status, it helps you to manage the health situation and perhaps get that health situation cured. We went through it from the registration to the checks on basic health requirements and all of that. It's been a very seamless process.
Omo Aluke Ajakaye, TMC TV News. Make una remember, say your PVC, that be your power. Not saying I'm giving a politician on election day.